Hello, and welcome to the Christopher and Dana Reeve Foundation professional webinar. And thank you for attending today on this very somber day in our country. We appreciate the time that you're taking to tune in. I am Nurse Linda for the Christopher and Dana Reeve Paralysis Foundation. And today I have on a pink shirt, and since it's a somber day, I put some flowers on around my neck. I have brown hair. I'm lightly pigmented skinned woman, and since I have pink on, I put my pink glasses on. So there we go for that. Today we have a wonderful guest, Dr. Kevin Kilgore, who is here. He has a degree in biomedical engineering, and he is also from an MS, a BS, an MS, and a PhD from Case Western University. He's the P. Hunter Peckham and George Picha Professor of Biomedical Engineering in the Department of Orthopaedics and Department of Physical Medicine and Rehabilitation at the MetroHealth System and School of Medicine at Case Western University. He's also a biomedical engineer in the research service of the VA Northeast Ohio healthcare system. If you're in that VA system, which all that information gets spread to all the VA systems. And he's the associate director of the Cleveland Functional Electrical Stimulation Center. So welcome, Dr. Kilgore. It's wonderful to have you here. Would you like to describe yourself?
All right. Yes. Thanks, Linda. Thanks for having me. I'm Kevin Kilgore. I'm an old man, is what I am. A white guy with a bald head. I wish I had some hair. What hair I have is pretty gray. Let's see what else. A beard, glasses, and I have the required light blue shirt that every engineer is required to wear, I think, for their entire lives, as far as I can tell. And a very white, I tried to find the plainest wall I could find in our lab. So it's totally white behind me.
Right. Well, I'm glad you're dressed in the engineering outfit so that we can see. I have had lots of questions about FES and how it works in the body. And we talk about functional electrical stimulation all the time, but the question that people have is what's going on? How does
Right.
it work and what's going on? So we have the premier engineer, Dr. Kilgore, here to tell us all about that. So before we get into that, let me just ask you quickly, what sparked your interest in engineering, in FES? How did you get involved in all of this?
Yeah, not to take too long, but as a kid, I was always fascinated by physiology and anatomy. So when I was, in third grade, I was convinced I was going to become a doctor because that seemed to be the right thing to do. And then I got interested in machines and robotics and things like that. And so eventually ended up in, combining the two into biomedical engineering. And I went to the University of Iowa. That's where I got my bachelor's degree. And I decided I really wanted to go to graduate school. And I started looking around for different programs. And I landed at Case Western Reserve University in Hunter Peckham's lab. And we were doing, this was in the early 80s. We were doing some of the early days of electrical stimulation for hand function for people with spinal cord injury. And, as soon as I was here in Cleveland, I said, this is the greatest thing ever. Like, this is what I want to do. And so within a few months, I started lobbying Hunter. I started bugging him and saying, when I graduate, can I work here? And I think he thought I was a little bit strange, but anyway, I did. As soon as I graduated, I started working here as an investigator, and I've never left. Hunter and I have been working together for whatever it is, a little over 40 years now, I guess, working on this project. There's a lot of us actually who worked together here for a long time. So it's, to be able to work on technology that helps people be more functional is fantastic, actually. So I wouldn't want to do anything else.
Well, when you said I started in Dr. Peckham's lab, I thought, oh, well, there's the answer right there. Because
Yeah, right.
if you're working with him, he's so fabulous. So, and how lovely it is that you are continuing and expanding on everything that he does and is doing as well. So tell us about FES. We're just going to let you just be
That's all right.
you and tell us all about your deal.
All right, that sounds good. So I'm going to share some slides. And just what I'm really hoping is that, these will help people like kind of put some of the different approaches to stimulation in perspective, I guess. And to me, I think that, if I was looking in from the outside at all the different ways electrical stimulation is used, even just in spinal cord injury, but, even more broadly, I think I'd be pretty confused too. So I'm going to see if I can kind of put it in some different categories that I hope is helpful. So maybe to start out, just, thinking about electrical stimulation, what is it? It's just using small electrical pulses to activate nerves. And that's really all it is. But it's a pretty powerful technique. And I would say the most famous application of electrical stimulation for medical purposes is the cardiac pacemaker. And there's, almost 1 million cardiac pacemakers implanted every year to keep people's hearts beating. And so what is so great about electrical stimulation when we're thinking about spinal cord injury? And I would say the thing that is really exciting about it is that you can stimulate a paralyzed nerve and it will respond just as if the brain had activated it. So if you stimulate a nerve that is going to a muscle, you can get that muscle to contract. And even if it's paralyzed, even if it's not connected to the brain anymore because the spinal cord is damaged, that muscle will still contract. And so that's what's exciting, I would say, about the use of electrical stimulation. And it works on any nerves that have been paralyzed, really for any length of time. And I'll talk about that a little bit more later. But as long as the nerve remains alive, electrical stimulation will work. I had to give at least one engineering slide. So here's my technical slide. I tried to avoid too many of these. But I wanted to just give people a sense for when we talk about using small pulses, like how big are these small pulses that you're talking about? So maybe if I start from the bottom, a refrigerator, as far as current goes, needs about 5 amps or thereabouts, which is 500 milliamps. When we talk about electrical stimulation, we're talking about something in the range of 1 to 20 milliamps. So more than 100 times smaller in terms of the current, and very short pulses, whereas your regular house current is at 60 hertz and continuous. For electrical stimulation, we're talking about very short pulses, tens of microseconds. And that single pulse is enough to cause a muscle to twitch. And if you twitch it fast enough, about 20 times a second roughly, you'll get a muscle contraction. And if you stimulate enough muscles and coordinate them, you can actually produce movements. So you can cause someone's hand to open or close. You could cause someone to stand up, take steps. And it works on organs as well, especially, for example, the bladder is just a muscle. You can cause the bladder to contract. And so there's a variety of different uses, particularly in spinal cord injury, where electrical stimulation can be used. So I don't know if that's helpful, but one thing to say is that if you try to stimulate a muscle from the skin surface, which you can do, That takes about 100 milliamps. Typically, those little stimulators that you use for that go up to somewhere around 100 milliamps. When we have an implanted device or like a pacemaker, those are around the 1 to 20 milliamp range.
So I have a question about your graphic down there.
Yes, I'm sorry. Yes.
No, that's okay. Um, Down here in the center of the graphic, you have this black line, which is that, yeah, that thing.
Yes. Yes.
And is that showing the pulse of the electrical stimulation? Is
Yeah,
that showing how that?
I forgot to describe my little diagram down here. So yeah, so this is the current being delivered, and it's delivered as a short pulse. And these little red knobs here are meant to indicate an electrode, which really is some kind of usually a metal that is located near or on top of a nerve that you're trying to stimulate. So you deliver a very short pulse. Usually we do use one polarity and then another polarity, and there's reasons for that. It's actually safer if we do it that way, safer to the nerve and to the tissue. And then when we stimulate a nerve, it actually delivers the nerve signals in both directions on the nerve. So in one direction, let's say this is a nerve to a muscle. So in one direction, that signal will go down to the muscle, which is these red fibers down here. And that will cause that part of the muscle to contract. There is also a nerve signal that will travel up to the cell body, which is shown here. And that doesn't really do anything, but it's just one thing to know is that it always travels in both directions.
That is
On nerves.
important to know. We have a couple of questions before you move to the next one.
Sure.
What
Yeah.
the first question is, what do you mean by paralyzed but alive for the nerve?
Yes. Okay. So that is a very good question. So in a spinal cord, and this is particularly relevant to spinal cord injury. In a spinal cord injury, there's a region of the spinal cord where the communication from the brain down to the periphery has been damaged. So from the brain to the muscles, let's say. But the nerves that are in the chain below that, so for example, there's a motor nerve that goes from basically the region of the spinal cord all the way down to the muscle. That nerve is often not damaged in spinal cord injury. Those nerves remain alive. And actually, let's say you have a spinal cord injury in your neck, let's say at the 5th cervical level in the middle of your neck. Every nerve below that is still alive and it's still functioning. It's just that it can't get any communication from the brain. And so one nice thing about electrical stimulation is we can still get those nerves below the level of the injury to be active and to cause muscles to contract or to cause the bladder to contract, because they all remain alive. And they will continue to stay alive unless there's some other damage that the person has. But in general, in spinal cord injury, the nerves below the region of the spinal cord injury will stay alive and active. That's why, like if somebody gets spasms, for example, the reason they get spasms is those nerves are still active. They're just not getting signals from the brain.
Okay, good. That's quite specific, so thank you.
Sorry. Yes.
No, I liked it because that is an excellent description of what's going on in there.
Was there another question, Linda?
Nope, just
Okay.
those two.
So one of the things that I just wanted to point out, and this maybe doesn't matter, to anyone except those who are doing electrical stimulation for research purposes, and that is that we often say that we're stimulating a muscle. And in fact, we put electrodes, we put like the skin patches on directly over muscles, and we say we're stimulating a muscle. But actually, that's not technically true. What we're actually doing is stimulating the nerve to the muscle. It's very hard, in fact, to stimulate a muscle directly. It takes a lot more current to stimulate a muscle directly. In fact, usually by the time you're stimulating a muscle, you are actually causing damage. The electrical current is so high that it's actually going to be causing damage. And so the reason I bring this up is because this is why electrical stimulation is useful in some injuries and diseases and not in others. So in spinal cord injury or stroke, the nerves to the periphery are all active and you can stimulate those. But if you take something like a disease like muscular dystrophy, for example, there the muscle now is no longer able to be stimulated, or even ALS. In that case, the nerves actually degenerate, and so it's very difficult to stimulate those nerves. So that's why, in general, we're using electrical stimulation in spinal cord injury, stroke, MS, cerebral palsy. Those would be probably the most common places where stimulation is utilized.
Now, I think you answered Diana's question. She wrote in a question, but I'm going to ask it to you, so just to make sure you covered it.
Yeah.
How is the stimulation of specific muscles controlled?
Yeah. So let's say we're doing stimulation for exercise. And in that case, we're just using a handheld stimulator. In that case, you're just controlling it with the dials on your stimulator. I think I have here. Here's a stimulator, right? So somewhere there's a button here that is, increased stimulation or decreased stimulation. And when you do that, that causes as you increase the stimulation, you're causing more and more of the muscle to contract. So it contracts stronger and stronger. And then you turn the stimulation down and then it relaxes. When we talk about our implanted devices for, let's say, hand function, then that control is different. And I'm going to show you some videos that I hope will help explain how we give the person who's using the stimulation, let's say for hand function, how we give them control over that so they can use it when they want to reach out and, pick up a glass or something like that. Okay, so here I divided the ways that electrical stimulation is used in spinal cord injury into 6 topics, 6 areas. And I'm going to go through each one of these and just give you some quick examples because I do think it's important to understand when people talk about electrical stimulation, it actually means a lot of different things. And in fact, the term I put down here at the bottom, the term FES or functional electrical stimulation might be used to describe any of the 6 things I've listed here. And they're actually quite different, as I think you'll see as I go through them. And so it's one of those things that, again, I feel like if I was coming from the outside, I'd be very confused. When people talk about FES, what are they talking about? Are they talking about exercise bicycles, or are they talking about implanted devices that are very, complex but provide function, or something in between? So the top 2 really are looking at strengthening, so strengthening muscles or improving fitness. And strengthening muscles, electrical stimulation is used not specifically just for spinal cord injury. It could be a sports injury or something like that. So we'll talk a little bit about those 2. And then the next 2, 3 and 4 also go together. So facilitating muscle control and recovering muscle control. And this really fits into the spinal cord stimulation area, which is, I would say, an area that has emerged much more commonly in the last 15, 20 years than it ever was before that. And so I'll talk a little bit about that. And then restoring function, which is the use of typically implanted devices to provide specific functions, hand function, standing, walking, whatever it might be. And then the last one I won't really talk about, which is pain relief. So a device that, like a TENS device, which is transcutaneous electrical nerve stimulation. Those are devices that you might use for pain relief. to stimulate over an area that is painful. And again, that's not specific to spinal cord injury, but it might be used in spinal cord injury. So if you hear of a TENS device, that's what that is. It's really a device that's just delivering a low level of stimulation that, at least for some people, reduces pain. And then spinal cord stimulation using implanted devices. It was originally developed in the 70s, actually here in Cleveland. And that is another way that people use to treat chronic pain, especially chronic back pain, and sometimes used in spinal cord injury.
There's a
So
question that came in. Oh, pardon me. There's a
yeah,
question
no,
that came in.
go ahead.
Can FES help reverse contractions in the hands?
Yes, so I hope to show you that a little bit, but that's one of the reasons to do muscle strengthening and fitness, to do stimulation itself, because that, for example, can start ranging. Let's talk specifically about the hand. So stimulation of the finger extensors to open the hand, and then the finger flexors to close the hand. So that kind of motion, which if your fingers are paralyzed, you don't get that motion without doing stimulation. And so we actually, we like to have people exercise using the electrical stimulation because it maintains that range of motion as well as strength of muscles. So in fact, let me, I did want to say this. So my world, that is my research world where I've spent my whole career, is in number 5 here, so restoring function. So I do have some slides later specifically about that, but I wanted to kind of put it all in perspective, and hopefully it helps people to understand this broad world of electrical stimulation.
It does get confusing, so that was very helpful. Thank you.
So I'm going to just talk a little about each one of those, just to give you some examples of what fits into these categories. So for strengthening muscles, stimulated exercise, the idea here is to make weak muscles as strong as possible, or as we just talked about, improving range of motion. Now, in general, this is applied to muscles that are already that are not paralyzed, but they are, well, they're partially paralyzed, probably, they're weak. And so by stimulating them, what you're really doing in most cases is strengthening the part of the muscle that is not paralyzed, making it as strong as possible. And again, this works in spinal cord injury, but it also works in people who don't have spinal cord injuries. So it can be used for like sports therapy and things like that as well. And usually this is with surface stimulation. So these are the kind of skin patches. You probably can't see, but things like these little round patches that you pull off and you stick on your skin somewhere. Let's see if I can do this. Stick this on, and then you connect a stimulator to it, and that will stimulate the muscle that's underneath this electrode. It's often combined with other therapies. A lot of physical therapists use electrical stimulation along with their therapy. And the strengthening of a muscle takes weeks. It's a lot like exercise. And if you stop stimulating, it could fade. Although if you're actively using those muscles, you can probably maintain them. But a lot of times, this is the kind of thing you might do for a while and then strengthen a muscle and then come back to it later. A typical device that does this kind of stimulation is called neuromuscular electrical stimulation, or NMES. You can buy these devices. They're all over the place. Anyone can buy them. If you want to buy something that you want to use to stimulate your own muscles, you do want to make sure that it's a neuromuscular or NMES device as opposed to a TENS device. So a TENS device, a TENS device has a lot less current. It's just trying to provide sensation that helps with pain relief. So if you want to get the muscles to contract, you need a little bit more stimulation, and that's what an NMES device does. So just a couple pictures. Here's, a couple of electrodes. They're just patches that are put on the skin. They can be put on your arm, legs, anywhere in the body. You can place these electrodes and stimulate the muscles that are underneath them, or the nerves that are underneath them, depending on what you're trying to do. So these are pretty common and used for exercise all over the place. The next one is a little more specific to spinal cord injury or people who have pretty extensive paralysis. And in this case, you're combining the stimulation of a number of paralyzed muscles in a coordinated way with voluntary movement to try to gain the benefit of regular exercise. So, everyone knows when you have a spinal cord injury, it's very hard to exercise because you can't exercise the big muscles of the body. If your legs are paralyzed, it's hard to get that cardiovascular benefit that you get from that an able-bodied person would get, say, from running or jogging or riding a bicycle. So typically, this kind of electrical stimulation uses surface stimulation, and it is combined with exercise equipment, usually an exercise bike, because that takes balance out of the equation. So you can sit either in the bike or sit in your chair, and then you can use the electrical stimulation to move your legs in the cycling motion and get the benefit of exercise. So this, and like all exercise, the benefit builds up over time. If you stop exercising, it fades a bit over time, unfortunately. And so that is how exercise works. And typically, the devices here are the FES bikes. So if an FES bike, and there's a variety of different kinds, but here's one where you can stay in your wheelchair. These are the patches, the electrodes that stimulate the muscles that are paralyzed. There's always some kind of controller because you have to coordinate all the different muscles so that the person's legs make the cycling movement. And usually it's something you just start and it runs for a while and then you stop it. So there isn't a lot of direct control over something like this. So that's exercise. And that's kind of the first two areas. Now, the next two, I would say, are a bit newer, and I reversed the order a little bit. So I'm talking about number 4, and then I'll go to number 3. But they are closely related, and I think you'll see why I started with this one. So here is the epidural spinal cord stimulation or the transcutaneous spinal cord stimulation. And in this case, the idea is to use stimulation typically over the spinal cord to try to restore or potentially replace connections between the brain and specific muscles. And the major benefit here relative to all other uses of electrical stimulation is that if you can restore a connection, it can be gained even when the stimulation is turned off. So unlike, let's say, for exercise or some of the other things we'll talk about, for this type of electrical stimulation, it's used for a period of time. A person gains some restored function, say maybe some better leg movement or something like that, and then they can stop using the stimulation, but they still have the function that they gained. So that's the exciting thing about this particular application, is that you gain this function potentially for the rest of your life, potentially. Again, the stimulation here is applied to the spinal cord, and it can be either on the skin surface over the spine, or it can be an implanted device where the electrode is on the back of the spinal cord. This typically requires a lot of repetition. That is, there's a lot of daily stimulation that you have to go through. A lot of times this is combined with other rehabilitation and therapy approaches. And it can take weeks to months before you get some kind of recovery of stimulated function. And the typical approaches here are transcutaneous spinal cord stimulation. That's with the electrodes that are on the skin surface. And then epidural spinal cord stimulation is with an implanted stimulator. And the electrode is laying on the back of the spinal cord in that particular case. So I'm going to talk about number 3, which I called facilitate muscle control. It's similar but different, but it's the same kind of approach. So this is generated again by electrical stimulation over the spinal cord. But in this case, the function that is restored is function that is from the brain to a particular muscle. So for example, you might gain now the ability to lift your foot. But the difference is that you only get that ability when the stimulation is on. And so when you turn the stimulation off, you can no longer make the motion that you need to make to lift your foot. But as long as the stimulation is on, you can lift your foot, you can relax your foot. It's as if you had control over it. And I liken this to turning up the light in order to see better. I don't know if that's a really good analogy or not, but I tried with that. It is different than the previous one, which I called recovering of muscle control, because in that case, you still get the function even when the stimulation is turned off. So recovering is stays there even when the stimulation is off, whereas facilitating, you are gaining control over a new muscle, but you have to have the stimulation on in some kind of pattern in order to get that function. And this is, as far as I know, I'm no expert in this particular area, but as far as I know, this has only been observed with epidural spinal cord stimulation. And so just some pictures here. I know that if you go in the Ask Linda archives, you'll find a discussion with the group at SpineX. Yep. I don't think that was too long ago, actually. And so that's worth looking at. But here's transcutaneous spinal cord stimulation. Here's epidural spinal cord stimulation. You can also, or at least people are doing research into whether you can get a similar kind of recovery effect by stimulating muscles in the periphery. I think this is the mind move approach. And there's a number of groups and companies that are working in this area. So it's a pretty exciting area of, I would say, emerging work using electrical stimulation. And then the last one that I'll talk about is restoring function. This is what we would typically refer to as a neuroprosthesis. And the goal here is to coordinate stimulation of multiple muscles or organs to provide some kind of function. So in particular, the systems that I work on, it's to provide hand opening and closing, sometimes wrist motion and other upper extremity functions like that, sometimes reaching overhead. And so we'll stimulate a whole set of muscles, sometimes a dozen different muscles in the forearm and hand. And then we coordinate the stimulation to produce, let's say, grasp opening and closing. And I'll show you some videos of these in a moment. But so the idea is to provide function. So you can reach out, put your hand around something like a glass, and then drink from it, set it back down, and let it go. But you also need control over the stimulation. And there's a variety of ways to give the user control over the stimulation itself. You could do something as simple as a switch. You hit a switch that closes your hand, you hit the switch again, and it opens your hand. That can work. That's usually not particularly elegant, and it's a little clumsy. So we typically use other movement from other parts of the body. We record muscle activity, let's say sometimes we can use the neck. We can use forearm muscles if someone has those that are still under voluntary control. You could use voice control. And of course, there's quite a bit of research in looking at whether you can get the signals directly from the brain and use that to control the stimulation. That is a neuroprosthesis. And the benefit here is that the function that is restored is fairly instantaneous. And by that, I mean that it's a lot like a light switch. So when you turn the stimulation on, the muscles immediately respond. And let's say the hand opens and you then change the stimulation and the hand closes. And so it happens instantaneously. And also the results are fairly predictable because we understand exactly how this particular stimulation works. So before someone has an implanted device, undergoes surgery for an implanted device, we can predict quite well what their results are going to look like through our initial evaluations. The technology, it involves stimulation applied to multiple muscles and nerves. It typically requires a surgical implantation. It's an implanted device. And again, we call these neuroprostheses. I wanted to show just a little bit, a very brief video here that shows essentially how quick it is to learn to use a system like this. So this particular individual has a C6 level spinal cord injury, motor complete spinal cord injury. And this is with the stimulation turned off. And just showing that this particular, this is a can-shaped piece of plastic here. So the idea is, can you pick up like a can, a drink can, something like that. And you can see that with the stimulation off, her tenodesis grasp, it's just not tight enough to hold this. So it just slips right out of her hand. And in the right here, where the stimulation has been turned on. Now this is the first time that we turned the stimulation on for this person. So they're learning it for the first time. And you can see that the very first time that this person tries to pick up the can, they're able to do it. We try to make the control system be as natural as possible so that it's fairly, I guess I would say, intuitive in the way that you can control it. In this particular case, what we're using is we're recording the signal from her wrist extensor muscle. So, which is the muscle that she uses to pull her wrist up against gravity. And when she fires that muscle, we then stimulate the muscles to close the hand. And then when she relaxes that muscle, we stimulate the muscles to open the hand. And so it works very much like a tenodesis grip. So if someone is listening and they have a cervical level spinal cord injury, and if you have wrist extension, you've already learned that if you pull your wrist up, you can pick up light objects like a potato chip or maybe a piece of paper or something like that. Just because when you pull your wrist up, your hand naturally closes. It's not very strong, but it's pretty useful. And what we're able to do with the electrical stimulation is now convert that tenodesis from being a kind of a weak, very passive motion to something that has the force of the muscles behind it. So it becomes very strong, but it's still the same motion. You drop your wrist, your hand opens a little bit, you pull your wrist back up and your hand closes. So I hope that helps. I've got another video also that kind of shows how this control happens. But anyway, I just wanted to show that this can be pretty quick to learn once you've healed from the surgery, I should say. Yes, so you have to go through surgery, and that is difficult, and I don't want to sugarcoat that at all. And typically after surgery, We have people heal for about 3 weeks, and then we start the stimulation. So that period of time is certainly difficult. But once we've got everything up and running, it's pretty straightforward to use.
But that quick result has to be quite gratifying for everyone.
So it's funny. Yes. So it's a quick result. It also, I would say that people do get better over time. So I kind of liken it to, yes, you can learn to throw a ball, but it takes a long time to throw a curve, right? Or, something like that. And I do think that it is exciting that in the very first day, people can start picking up objects or hold a fork in a way that they never could before. And then they go home. We send them home after we've given them some therapy and training. And they go home and they try, I don't know, they try the doorknob in their house or something like that. And then they come back to us and they'll say, well, I can do a fork and I can pick up a glass, but I have a really hard time doing, manipulating the doorknob in my house or whatever it might be. And so then we can start modifying the grasp pattern that they get so that it works well for, let's say, their specific doorknob, or teach them tricks so that they can learn how to use the stimulation with their particular doorknob to take advantage of it. So it's quick, but it's also going to be, probably quite a while to really master the use of the system. So maybe as a summary for this, so you asked a short question and I talked a long time, I'm sorry, but I really thought it would be helpful for people to be able to compare these. And so this is kind of my summary slide. So I have to say that, again, I work in the area of neuroprosthetics. I am not an expert necessarily in the use of stimulation for exercise and things like that. So others may have, different views, but here's my view. For strengthening muscles and improving fitness, I combine those things. Exercise fundamentally is basically probably always beneficial. The improvement is often not dramatic, it's fairly slow, but still that is to keep your muscles moving, to maintain range of motion. All of those things are beneficial for a variety of reasons from a health standpoint, and also to participate in any of these other types of treatment. The facilitation or recovery of muscle control, this is using the spinal cord stimulation. The great thing about this, in my view, is that it recovers some normal function. I put normal in quotes, but what I mean by that is that the function that you get in some cases is the function that you had, or it feels like the function that you had before your spinal cord injury. So you think about, trying to lift your foot, and now with this stimulation and treatment, you can now lift your foot. The difficult part of this, so that is very exciting. The difficult part is it's hard to predict what the extent of recovery is going to be. And at least from the experiences that I've heard from a variety of different people, for some people at least, it seems like this is essentially life-changing. In other words, they go from maybe not being able to walk to being able to walk. So that is fantastic. I think for a lot of people, what they gain is some additional function. For example, now they can lift their foot where they couldn't lift it before, but it's still not enough that, they can get up and get rid of their wheelchair and walk around the community. It does seem to be best for people who have incomplete injuries. So if you're in what's classified as group C or D, where you have some muscle function below the level of injury, it seems like this type of treatment works best for someone who's in that category. Maybe also in group B, where you have at least some sensation below the level of injury. But I would say the jury is probably still out on that. I don't think there have been a lot of studies using spinal cord injury. I'm using spinal cord stimulation in those who have complete injuries, those who would be classified in group A. So we may find that it actually works pretty well for those, but it just takes a lot of time to do that. Generally the person recovers slowly over a period of weeks, sometimes months, that this therapy is applied on a pretty regular basis, usually multiple times a week. When we talk about neuroprostheses, there is a predictable recovery of function because we can test the stimulation before we do the surgery. It can be fairly rapid once the person has been healed from surgery. One nice thing is that this type of electrical stimulation works very well for people who have complete injuries. In fact, in my career, most of the time I have worked with people who have either a group A or a group B complete injury, motor complete injury. A disadvantage, though, is that it's an indirect control of function. So whereas here, when we're facilitating or recovering the muscle control, it's your brain thinking the same thoughts that you thought before, or roughly the same thoughts that you thought before your injury to move your foot. When we're talking about a neuroprosthesis, you're doing something that is indirect. So I showed you the video where the person was using she was using her wrist extensor to open and close her hand. So that's a little bit indirect, although it's somewhat natural because of a tenodesis grip. It's still, that's not the way you opened and closed your hand before your injury. So it's not like you have now a new connection directly to your finger flexors and finger extensors. And it typically requires surgery. It's an implanted device. So that is obviously a disadvantage of that approach. One thing I will say about electrical stimulation is that it works regardless of the time post-injury. And so we've had people who came in who are 20, 30 years after their injury, and we're able to do electrical stimulation with them. We can give them an implanted device and they gain function. They gain hand function or whatever it might be. So that's one really good thing. So don't think that just because you're, 20 years post-injury, that you can't take advantage of it. In general, it's going to work regardless. And I did mention before, it does not work if there is peripheral nerve damage. That is lower motor neuron injury, which is a long term, but basically some of your peripheral nerves are actually located in your spinal cord, which is kind of an oxymoron, but that's the way it is. And sometimes at the time of your spinal cord injury, some of those peripheral nerves can be damaged as well. And in fact, for someone who has, let's say, some extreme atrophy in their arm, that usually indicates that the peripheral nerves have been damaged, and they were damaged at the same time that the spinal cord was damaged, usually. But that's something that's fairly easy for us to test. We can use electrical stimulation, surface stimulation to test and evaluate whether someone has that kind of nerve damage.
There's a couple of questions that have come rolling in.
All right, good.
Here's one. Can NMES help with increasing lung capacity, breathing, and how effective for injuries over 40 years?
So for injury, the second question is easy to answer. So electrical stimulation is definitely effective regardless of the time post-injury. So 40 years, that would be fine. What we find in the hand is the only thing that really, let's say, disrupts the use of electrical stimulation is the development of joint contractures. And so over time, if someone is developing contractures in their hand, it just makes it a lot harder to use the stimulation to open their hands, for example, or vice versa.
Yeah,
Stimulation,
we have,
whoop, I'm
sorry.
sorry.
No,
And
go right ahead.
stimulation is used to increase breathing capacity. So there are applications of electrical stimulation to the phrenic nerve and to the diaphragm to increase lung capacity or to try to wean people off of ventilators. And you know, the founder of the Reeve Foundation might have experienced some of those benefits of those particular systems.
And now I'm going to give you a rapid fire list
All
of
right, good, go.
diagnosis. Diagnosis. Will this help this one, that one?
All right.
Nemaline myopathy. It's a
I
genetic disease.
Yeah, so anything that ends with myelopathy is indicating that there's some damage or destruction to the muscle. And so I would say it's unlikely. I don't know that's particular disease, but I would say it's highly unlikely that electrical stimulation could be used in that case.
Okay, how about a neuropathy for ambulatory patients without spinal cord injury?
So there, it depends on where the nerve damage is. If the damage, and also how extensive the damage is. So if the damage is in the peripheral nerve to the muscle, it will be very difficult to stimulate that nerve. But that's something that is quite easy to try. A surface stimulation applied in the right location will quickly allow you to determine whether you're able to stimulate that muscle or nerve or not.
Okay, and here's the question about for the surgically implanted devices, does it take someone other than the SCI person to control the device?
No, no. In fact, can I go to another video, Linda? Is that okay?
Yes,
So
that's fine.
let me show this. I want to just quickly skip ahead. So this is a few pictures of our implanted devices. These are the different grasp patterns that we can provide people. But I want to show this video that shows how it is controlled. So it's very important that to recognize that the person with the spinal cord injury is the one controlling the stimulation. Nobody else is involved, right? I mean, we have to program it and get it set up, but once it's set up, the person using the system is totally independent. And so this guy is just showing how the system works. So on his smartphone here, he has a button he can push to turn things on and off. And so in this case, he's just turning the stimulation on. And then he's showing you different grasp patterns and how he opens and closes his hand. And in this case, again, he's using his wrist motion to open and close his hand, which we're recording from the implanted device. So when he pulls his wrist up, his hand closes. When he drops his wrist, like he did right there, his hand opens. And he has different grasp patterns. They're programmed differently, so he can pick up different kinds of objects. But he has complete control over it. It doesn't require somebody else to step in, say, and push a button for him. He has complete control over it.
That's great. Autonomy is always a wonderful thing.
Yeah.
Do you think it's better if people start using these devices immediately after injury, or is it okay to start years after injury?
Yeah, so there's some benefits. I would say there would be some benefits to using these systems soon after injury, but in general, I think it's hard for someone, let's say, who is a couple months, a few weeks out from their spinal cord injury, to think forward enough to say, oh yeah, I'm ready to have an implanted device put in my body to give me hand function. Or walking function or whatever it might be. So in my view, something like, say, starting around 6 months after a person has been injured, um, to say the first couple years, I think that is a good time to get evaluated for these systems, to really understand the kinds of function that you might be able to gain and see if it's the right thing for you. But really, if someone is sitting out there who, again, who's been injured for 10 years, there's no reason not to come in, be evaluated, and see if maybe this might be of benefit.
So if you're out in the community, do you have to go to Case Western to be evaluated by you? Can I get one of these in my hometown?
Yeah, so
Yeah, that's the $1 million question here.
yeah, so I'm going to skip way ahead because I just put a slide and I want people to be able to get this email. Um, so you at the moment, you do have to come to Cleveland. Cleveland is a wonderful place, and but I will say this: first of all, we're doing a clinical trial. It's ongoing right now. If you're interested, here's the email: this ue.fes.clinicaltrials@gmail.com. We can start an evaluation virtually. So one of the questions and one of the hard things is, you really don't want to have to travel all the way to Cleveland to find out in 5 minutes that, oh, this isn't going to help me. And so we try to do as much as we can, through conversations with people, through videos. That could be quite helpful. We do have an assessment an assessment clinic in Cleveland. So when people come, we'll do a full assessment, and we'll try to evaluate whether a person can benefit not only from stimulation, but also from some other procedures that we do. We are trying to establish other clinics and other places where you can get this done across the country. And we have a group in Philadelphia at Thomas Jefferson University. That team, some of the people we've worked with actually for a long time and known for a long time. And sometime in the next few months, actually, we will be doing the first person together, and they will be following that person in Philadelphia. So if you live on the East Coast, I-95 somewhere, it would be a lot closer to go to Philadelphia. So probably, in the near future, they will be ready to, they're certainly already in a position to do the screening, but they would also be in a position to do the surgeries and the follow-up for this system. The other thing I just want to mention is that we do have free lodging available in Cleveland. So I know it's difficult to travel with a spinal cord injury, and I appreciate that. But one thing we can do is once you get here, we have a place that it's fully accessible. It has overhead track lifts. It has roll-in showers. All the things that you would want to have to be accessible. So at least once you get here, there's a place where you can stay and during the evaluations. And then if you were to go on further to get one of these implanted devices, you can stay here for the surgery and things like that.
Well, we're coming close to the end of our time. You certainly have given us an abundance of information that's so valuable. I know there's a lot of people who are wanting more. As the hour goes by so quickly,
Yes,
and
it
when we have
does.
such an engaged presenter who truly loves their work, it's just a wonderful time spent. So I would like to remind the listeners that if you want more information, you can contact the Reeve Foundation. You can certainly contact the Cleveland Clinic there. You've got the information there on how to have contacts there. this program is recorded and it's available on YouTube because, we're all modern now. So if you go to the Reeve Foundation channel on YouTube, look for Nurse Linda. It's in the professional webinar series. All of our professional webinars are listed there. If you have more questions, you want to talk to somebody, you can call the Reeve Foundation Information Specialists, and their number is 1-800-539 7309, or you can go to the foundation website and be able to click right on there and find out um, more information about anything you would like to know, if it's about this or any kind of information. So I would like to thank you very much for joining us today. Thank you, Dr. Kilgore. We hope to hear more from you and your group and what's going on. And anytime you want to come back and talk some more, we're ready to listen. So
All
thank
right.
you. And thank you, everyone, for attending today.
All right. Thank you. Thank you, Linda.